Similarly, coming to clubbing, clinical anatomy and pathophysiology, clubbing develops when there is increased vascularity in the nail bed, leading to hyperplasia of fibrous tissue. And this causes thickening of the tissue beneath the nail plate, giving the diagnostic criteria of what is called the loss of hypopharyngeal angle, fluctuance in the nail bed, and abnormal pharyngeal depth ratio. So this picture will tell you what is this pharyngeal depth ratio. This is a normal side. You find near the base of the nail, the depth is less, whereas at the interphalangeal joint level, the depth is more. This is how a normal finger or a digit should look like. Whereas in clubbing, what happens, this interphalangeal distance is reduced and the tissue level depth is increased. So this is the change. This is what is called the phalangeal depth ratio. This is called the hyponychial angle or the Lowy bond angle. This is the normal ABC, less than 180 degrees. Whereas when you get the clubbing happening, it becomes more than 195. You can see this B angle is getting wider. And this is what is called the Shamrock sign. In a normal patient, when they oppose the terminal digits of the two index finger, you will get a diamond-shaped gap in between. Whereas in patients with cyanosis, clubbing, this window will be closed. So this is what is called the classical Shamrock sign. And based on this, you can grade the clubbing into grade 1, 2, 3, 4, 5. And the description, initially it is only a fluctuation and softening of the nail bed. Later on, the loss of angle happens. This is a Lowy bond angle or a hyponychial angle. Then accentuated convexity of the nail. Fingertip develops a clubbed appearance. Nail and surrounding skin develops glossy change with longitudinal striation. And some books say that the osteodystrophy at the lower end of radius, it can go up to that. That is all the increase in the thing. And the theories that have been proposed are the neural reflex theory suggests that vagus nerve has a pivotal role in the etiopathogenesis. It causes clubbing and the toxic, it causes vasodilation. And toxic substance theory says that there is a normally deactivated substances in the lung are not deactivated properly, and they cause selective peripheral vasculature, act on that vasculature and cause vasodilation. And the third theory is the platelet theory, where platelet-derived growth factor following impaction of megakaryocytes and platelets in the peripheral vasculature, they release substances which increase the growth factors both from platelet as well as the vascular endothelium, which causes improved increase in the fibroblastic activity and hypertrophy of smooth muscles. Now, causes of clubbing can be classified into idiopathic and acquired, and this is the mnemonic that may be useful. C stands for cyanotic art disease, cystic fibrosis. L for lung cancer, lung abscess. U for ulcerative colitis. B for bronchiectasis. B for benign mesothelioma. And of course, there are a number of things that are given. And unilateral clubbing may be in the upper symmetry due to anomalies in the subclavian artery aneurysm or aorta branches. All this